For some reason, mental health diagnosis is a bit of a controversial subject, and some people think that it's all a flim-flam, and other people think it's really important. Well, let this child psychologist weigh in. Let's get started. Hi out there, this is Dr. Brett Pearce, child psychologist, coming at you with a video discussing the subject of mental health diagnosis. That is to say, the formal practice by mental health professionals and perhaps physicians in making mental health diagnoses. Things like anxiety, depression, ADHD, bipolar disorder, and things like that. This subject is interestingly controversial, and it's controversial in the field, meaning there's a lot of people who practice mental health who basically think that mental health diagnosis is more or less kind of some sort of artificial thing that's mostly bureaucratic red tape that's done for institutional requirements, things like meeting insurance demands, etc. And you have some people who think that the Diagnostic and Statistical Manual for Psychiatric Disorders, or in other words, the DSM, currently the 5TR text revision, it just came out a couple months ago. They more or less think that that whole thing is just a complete, sort of sham in many ways. Or if it's not a sham, it's just sort of kind of cute and not that important or not that interesting. And you also have some people who think it is incredibly important and want to spend a lot of time and energy going into all kinds of different details. So the subject matter of the DSM, as well as mental health diagnosis, is very broad, and it's not my intention to go through each and every tiny little thing. But let's basically talk about the subject of mental health diagnosis and what my thoughts are on it, with the full understanding that you're talking to someone who is a very well-seasoned diagnostician, meaning I do that at the highest, kind of like one of the highest levels. And by highest levels, I don't mean that I'm super special or something. I mean, sort of technically, I do a lot of assessment psychology, meaning I do a lot of formal psychological testing and formal evaluations for relatively important kinds of things like ruling out autism, ruling out intellectual disability, making diagnostic determination in really complex situations and things like that. I also have taught the subject of the DSM and mental health diagnosis at the graduate level before, and have even led workshops for other professionals on that subject as well. So again, I'm not necessarily trying to toot my own horn, but just acknowledging that maybe I'm a little bit biased because I'm kind of a diagnostics geek maybe sort of like a super geek in the area of mental health. And it is something that I very obviously believe in. But the reason that mental health diagnosis is a reasonable and important thing to do is, first of all, what mental health diagnosis often relates to is identifying and explaining a problem that someone is having with their behavior, their emotions, their psychology. And that may sound innocuous enough, but it really, really is important. And it is somewhat similar to if you were having a difficult time keeping your house cool enough in the summertime. It would be very difficult to solve that problem if you didn't understand exactly what is going on with the problem, because there could be a bunch of different reasons that your house is struggling to keep cool. And I won't try to go into that analogy too much because I'm not very handy and I don't know much about things like that around the house. So I would probably get lost in the woods there. But the bottom line is, it's important to figure out whether or not someone seems to be depressed, or whether or not they seem to be anxious, whether or not they have something like bipolar disorder or PTSD or ADHD. It turns out to be actually pretty important to figure that out. Whether or not you want to talk about a formal diagnosis a la the DSM, identifying kind of the nature of the problem is important. Why is it so important? Well, from a treatment standpoint, in terms of psychotherapy, I don't know. I mean, maybe the kinds of interventions that we would use with someone, depending on the kind of difficulty that they're experiencing, maybe those interventions aren't necessarily radically different. But hey, knowledge is power. And I know for myself, in my own personal journey, and yes, I do try to walk the talk that I give, and I was in my own personal therapy for about 10 years, that the more clear that I got on what exactly was going on for me in terms of my own growing edges and some of the difficulties that I faced down in my life and continue to face, that kind of clarity was tremendously helpful. And in my experience, it seems to be helpful for the children and the families and some of the adults that I've worked with as well. It's helpful to understand because there are important but subtle differences in terms of what we would do. And in some cases, those differences aren't even that particularly subtle in psychotherapy. And that's basically a subject for a whole other video, or 20 videos or something like that. Bottom line is, it's really important to identify the specific nature of the problem, because how are you going to go about addressing the problem if you don't go about identifying it specifically? Now, when that comes to more of like the formal things about providing a formal DSM-5 diagnosis, I would agree with you that there's times where there's a lot of kind of hand-wringing like details in some cases that don't seem critically important, or perhaps are less important than getting the ballpark thing right. So here's an example. It is really important to understand the difference between what people will describe as unipolar depression and bipolar mood problems. In other words, the difference between depression and bipolar disorder. That's really, really important. We know that's important from a medicine standpoint. And it's certainly important from a treatment standpoint. I mean, how are you going to help someone if you don't understand that they're having manic episodes, which is what happens in bipolar disorder? Like, if you're just sort of regarding it in this kind of uninformed or distorted way, that's probably not going to help. It's also probably not going to help if you don't understand that bipolar disorder is largely organic, which is not to say that therapy and coping skills and things like that don't help. They absolutely do. But that medicine is a really, really important thing for someone who has bipolar disorder, according to everything we know. Now, we might learn better ways in the future, but according to available information and treatment protocols, that's important. Another example in kids, it's really, 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 really important to get the difference between depression and anxiety versus ADHD. And that's a mistake that is made very frequently. Don't believe me? Well, according to what I understand, about 1 in 10 boys in this country gets diagnosed with ADHD, which is horrifically overdiagnosed in that circumstance. And research also indicates that very often the diagnostic mistake that's made that results in 10% of boys being diagnosed with ADHD is, in fact, mistaking depression and anxiety in boys for ADHD symptoms. And can you imagine what that would be like? How would it be like if you were struggling with a lot of emotional pain? Let's say it was anxiety. You were afraid and nervous and overly stressed out all the time. You were constantly worried about your ability to succeed in school, constantly worried about getting into trouble, constantly distracted by thoughts of dangerous things happening to you and your family. And this did, in fact, have an effect on your ability to perform tasks because you were so focused on other things, but that no one was helping you with it. No one was really understanding you. They were just basically saying, well, you're just distracted and hyper, and so we'll give you, we'll put you on a stimulant medication. So again, being able to identify those differences is really important, especially because our knowledge about mental health and behavioral health continues to really deepen and develop. And it's possible that, very likely that we'll experience, paradigm shifts, which is to say fairly big changes to the basic ways that we model and understand mental health. That's a normal process. But for the time being, yeah, it makes sense that getting even formal diagnosis correct is important too, because they can have all kinds of big effects on someone, and it can relate a lot too with how teachers and parents and things like that understand, say, a kid. in a circumstance where we're talking about, say, the difference between anxiety and depression. And by the way, that's a real common one that that we as child mental health professionals encounter, is that, trying to wade through that kind of a circumstance. So that's another reason that it is a good idea to perform a mental health diagnosis. Now, are there problems and pitfalls and even downsides to making formal diagnoses? Absolutely, of course. We could also call them like risks, and I think in many cases they're risks that are just sort of unavoidable. People make the argument that there's not a lot of good consensus or science behind all the mental health diagnoses that we have. I guess maybe, I don't know. I mean, I think there's a lot of really good scholarship and clinical practice informing a lot of these things. They're not perfect. We have been able to line up things like anxiety and depression with very well cataloged, psychological, social, cultural, biologic, kind of markers and tendencies. I mean, if knowledge is about being able to identify things in a way that's consistent, reliable, and useful, and allows you to interact with the world in more of a clear and effective way, then I think that mental health has demonstrated that pretty well regarding a lot of mental health diagnoses. But some people will say that they don't really feel like there's good science or scholarship, and usually what people mean by that is that, that you can't necessarily go into a lab and look at mental health diagnoses under a microscope. There's nothing wrong with looking at things under a microscope by any means, but that's just not how psychology works. Psychology it's different than that. So the means by which we understand it are a bit different. Other people think that mental health diagnoses can be kind of stigmatizing. I suppose that's true. But I think that's more about public attitudes and not necessarily the viability or usefulness of mental health diagnoses. But yeah, they can be stigmatizing. I also think that can sometimes be true of medical diagnoses. But again, what are we left with? Just sort of saying, okay, you've got a problem of some kind, and even that results in that. Even that is some sort of diagnosis. I mean, if you sit down with someone and say, you seem to be struggling with some sort of concern that relates with your emotional and mental and behavioral health, that's still diagnostic in some sense. So if we forgo the idea, the practice of somehow identifying the problem, then we're left into some interesting territory if we continue to take that to its logical conclusion. Other people think that there's a risk that someone with a mental health diagnosis is going to, in some way that perhaps isn't as helpful as we would hope, start to kind of internalize or identify with that diagnosis and have a hard time letting that go. Well, I guess. I mean, that can happen in any kind of circumstance that you can think of. Someone can get tied in with the kind of identity thing and lose track of their ability to interface with their life in a way that demonstrates a willingness to kind of learn and grow, or whatever it is that I'm trying to say. That could happen anywhere, and about almost anything. And I suppose it is a risk. But again, I don't think that that's a function of the problem with clarifying and identifying the nature of a problem and then connecting that with a formal mental health diagnosis. I think it's more just about kind of a common issue that many people face, which is learning how to learn and grow, and to try to maintain your personal power, or whatever it is I'm trying to say. I'm trying to say what I'm trying to say here really succinctly, but it's a really complex and important subject. I would hardly be trying to make the argument that someone with a mental health diagnosis can just sort of push a personal power button and the diagnosis is gone, or something like that, or the problem is gone. I'm not trying to say that. It's a lot more complicated than that. At the same time, I think we would all agree that anytime someone has a challenge and then says, well, this is just the way it is, and there's nothing I can do about it. Well, in some cases, actually, that can be wisdom, because we don't have control over everything. But in other cases, it can represent perhaps a difficulty kind of stepping into a stance of like, okay, well, what can be done about this? So at any rate, I'm getting off on a tangent. So I think these criticisms and concerns about mental health diagnoses are good things to think about. However, I think like anything, there's always a sense of kind of a cost and benefit sort of circumstance. And inevitably there are risks. And some of the most common things that we do that almost no one would say are really a problem or something that we shouldn't do, like say driving cars. I mean, there's always risks and concerns associated with them. So in my opinion, mental health diagnosis is a very good thing. I have seen it do wonders. I mean, I've seen it entirely reframe and shift circumstances where I'm able to sit down with, say, some parents and say, like, look, even with something that to me is as routine as something like a decent case of anxiety that I spot in a kiddo, or a decent case of depression. I'm not trying to say those things are not important. I'm just saying they're routine to me, being a psychologist, that even that can have a huge effect, usually in a good way, where parents and kids now have a good explanation and a word for something, rather than kind of thinking that the kiddo's just acting up on purpose, or the kiddo just thinking there's some kind of nebulous, big looming thing that's wrong with me, but I have no idea what it is. It gives us kind of structure and guidance for moving forward. And I really do think that that's fairly similar to saying, okay, well, your house isn't staying cool enough in the really hot summer we've had here in the Salt Lake area here in 2022. But that could be because your windows are open. It could be because there's, your AC isn't working correctly, and there could be 5 to 500 reasons that's going on. It could be that the power company cut off power. It could be, because you didn't pay your bill. It could be because the power is just out. Who knows? It could be that you have a bunch of, you leave your oven on all the time and it just generates way too much heat, too much for your air conditioning to handle. There's all kinds of things that could be going on. And in order for us to get results, we have to identify that more specifically so that we can then try to deal with the problem. And I really do think that it's reasonable to say that there's enough similarity to how mental health works. So at any rate, these have just been some of my thoughts on the subject of mental health diagnosis. It is, interestingly, a bit of a controversial subject. There are even practicing professionals who have some, they have some good faith arguments, but who basically think that the DSM shouldn't exist and that more or less mental health diagnosis shouldn't exist. But almost always, not always, but almost always, these folks do believe in specifically helping clients identify exactly what seems to be vexing them in terms of what issues in their life and what, psychological dynamics they have that seem to be connected with that problem. And for me, I'm just like, well, but you're getting into diagnosis there and indicating that inevitably we have to figure out the why and the what in order to figure out the how. So at any rate, thanks for listening. If you made it all the way to the end of the somewhat long video, please feel free to subscribe to my channel by clicking the button down below if you haven't already. Otherwise, stay tuned for more content in the near future. Thanks. Take care. Bye-bye.